Present a cardio case, and it is targeted for final year MBBS student. Before going through the case, the disclaimer. Mrs. Anjali Vag, here is the name is modified, 30-year-old female, residing at Manchester, Hindu by religion, homemaker, belonging to lower middle class family according to the Woodard scale, and was admitted on 23rd May, examined on 29th May. She presented shortness of breath for last 4 months and palpitation for last 3 months. So you have to mention the chief complaint. After mentioning the chief complaint, you have to elaborate it. So history of presenting illness or present illness. The patient was apparently doing well 4 months ago. Following that, she experienced shortness of breath, which was insidious in onset and gradually progressive. She was experiencing shortness of breath while walking for a few distance, and that was relieved with rest. So it is NYH grade 2. It was also relieved with a medication that increased urine output with some extent. There was no seasonal variation, cough with expectation, bluish discoloration of lip. So here you may be asked regarding the name a drug that increases urine volume, that is furosemide or Lasix, and how will differentiate from cardiac dyspnea and respiratory cause of dyspnea. So you may be asked regarding how to differentiate from cardiac dyspnea and respiratory dyspnea. Remember, the respiratory dyspnea is as like cough associated with cough with expectoration, and it is generally associated, like respiratory dyspnea is associated with wheezing. Cardiac dyspnea may have wheeze, but generally respiratory dyspnea is associated with wheezing. And plural type of chest pain, seasonal variation. So seasonal variation is associated with respiratory dyspnea. And respiratory dyspnea responds promptly with bronchodilator, but in case of cardiac dyspnea, it responds with Lasix generally. Now you have to remember one thing that is not mentioned in the standard textbook, like cough, like triple cough, then speed phenomena. So in case of respiratory dyspnea, there will be cough with expectoration, but in case of cardiac dyspnea, there will be cough multiple times, like 3 to 5 times. Then there will be ping for the sputum. So cough followed by sputum is cardiac cause. Cough with expectoration is respiratory cause. And she now coming to the history of presenting illness. She had also mentioned complaint of palpitation for 3 months, which was insidious in onset, gradually progressive, and with the same aggravating and relieving factor as in the shortness of breath. She also uttered of having fever, sore throat, and large joint pain during her teenage. So it is suggestive of rheumatoid fever, right? Neither there was any history suggestive of PND nor orthopnea. It will be better than writing that like this. Neither there was any history suggestive of PND nor orthopnea. There is no history of bipedal edema, yellowish discoloration of eye, pain at the right upper quadrant of abdomen, chest pain, recent history of small joint pain, decreased urine output. There also no history of recurrent fall, loss of consciousness, black tarry stool, neck swelling, weight loss, and recurrent fever in recent.